Hi guys, this is me, Gayatri Prakash, and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about 11th of February 2023 OET exam. So let's move on to the topics. Okay. So the first thing I just want to discuss with you all about OET writing. So what was the case note they have asked on 11th of February 2023 is it was a known case letter. So from Gulf countries and whomever it written the exam in Europe countries, so they all have encountered the same question type, and it was a known case letter. So here, a school health nurse writing a letter to the patient GP regarding her condition to make an immediate or urgent assessment on her condition. Okay, so let's move on to the case note. Patient name Kelly Sean, 16 years old, and she has some problem which is related to her mental health. Actually, she was just so withdrawn, loss of appetite, and weight loss, mood swings, and crying all the time, depression, and also she feels so lonely and withdrawal symptoms at home also. So these are the symptoms which is newly arrived to her and which was observed by a school teacher. So the school teacher rang the parents and informed the patient condition. The family member said, her mother said, the same symptoms that she is showing in the home also. And also the parents are separated, and her granddad, who is very close to her, and he died very recently. So since then she showed this all the withdrawal symptoms at home as well as school. And thereby the school teacher writing a letter referring her to a school health nurse. So when the school health nurse assessed her all the symptoms, and she came to know that she might have a query eating disorder. Thereby she is writing a letter to her own GP to make an urgent assessment by a mental health doctor through her GP. So this is the letter they have asked on 11th of February 2023 exam. Okay. So how we can write this letter for a known case? So this letter, as usual, like we are writing date. So the today's date they have given 7th of January 2023. That's we are writing on the top of the paper. Next we are writing her own GP's address, and then salutation. So if they have given the GP's name, you are writing the GP's name as dear doctor so and so. If they not given that, you are writing dear doctor. That's more than enough. And then we are writing the reference. In the reference we are writing the patient full name. Her full name is Kelly Sean, and the age is 16 years old. And now coming to the point of introduction. So introduction can be written for the known case letter. This is the way, like I'm writing to update the current health status of, or writing to update the current condition of Kelly Sean, who is suspected to have eating disorder. She requires your urgent assessment to make an appointment with your mental health doctor. Like that we can just write it. And now we are writing to a present medical history paragraph. So present medical history paragraph is a very important there, where we are just explaining about the overall symptoms of the patients. So what are the symptoms that patient is really suffering with? So that what is the grade in the school? So we are starting like that. For example, Kelly is a grade 5 or grade 7 or grade 8. What is a grade at school? And then she started to develop, has been suffering with the symptoms of, has been experiencing the symptoms of withdrawal, isolation, crying, mood swings such as depression and loneliness, not participating in any of the school activities, and then poor eating, weight loss. So these are all the symptoms that we are just narrating it. Therefore, the school teacher was referred her to the school health nurse. The school health nurse has done an assessment and made a call to her family members, and the mother also stated the same signs and symptoms that we are just writing it over there. And here we are not supposed to write the social background of the patient, because we are writing this letter to the patient's own GP. So it is not necessary to maintain the this is not necessary to write the social background of the patient. Social background is like she has the problem of like eczema, and then she has a headache, and also she has no old psychiatric illness, and also she has endometriosis, and she is on treatment for the same. So these are the things which is already known by a GP. So it is not necessary to mention it in the social background, and also in the present medical history paragraph. Mainly we have to omit the social background completely, because we are writing a letter to a patient's own GP. In the recommendation paragraph, we are just writing that it is highly beneficial if you could refer your patient to a mental health doctor for an urgent assessment and further treatment. or further management. Then we are just winding up the letter with a conclusion of please contact me for further details, and you are sincerely if they have given the name of the addressing person, and if they don't give the name of the addressing person, you can wind up with the yours faithfully. So it's a very simple letter, and it's same kind of similar letters we have already experienced before, writing to a GP regarding the children's condition or the patient condition by a school health nurse. So the somewhat similar thing. So only the thing is like what is the present compliance of hers that has to be elaborated as much as possible and make it as a 2 paragraph, as you are omitting the social background because of we are writing to a patient's own GP. Okay, so it was a quite good letter, I could say that. And next, coming to the speaking topic. So what are the speaking topics they have asked for the exams? So the first speaking topic number 1 is a post-operative ward. So there that we are giving the post-operative education regarding the hydrocele to the mother. So the mother is concerning about the baby who is suffering with the hydrocele. So the nurse is giving education regarding the post-operative management of hydrocele. That was the topic number 1. And the topic number 2 was like a brittle nail. So brittle nail, which has been already asked in one of the OET exams. So the brittle nail, the patient is knowing about what is the reason behind the brittle nails, and we are just doing the examination, and we are just telling the causes and root of reason behind the brittle nails, and then we are just providing the management, all those things. And number 3 is here the usual topic, one of the usual topics, I could say that, because here the patient is a diabetes, newly diabetes, and the patient was treated with the medications. Now the patient is shifted to insulin injection. So the patient is very anxious and stubborn to accept the insulin injection. So as a nurse, we are just explaining importance of taking insulin injection and the diet management and monitoring of the blood glucose level. So it is kind of like, I could say that it's a conflict management, but at the same time you're making them to understand, which means you're persuading the patient to do the right thing. So it is an insulin injection. So the 4th topic was like, we're just talking about the endoscopy procedure. So the baby is undergoing for an endoscopy procedure. So the mother is very anxious about the procedure. We are giving the brief explanation about what is the pre-preparation of the procedure, during the procedure what will be happening, and after the procedure what is that. So you're giving a brief explanations to prevent the anxiousness of the parents regarding the baby's condition. And the last one is IBS, which is also asked to be previous exams. So irritable bowel syndrome. So we are just discussing about the causes and discussing about the signs and symptoms, about the management and the diet. So these all things are that we are discussing with the patient. So these all are the topics which were asked on the 11th of February 2023 exam. Okay, so overall the exam wise, I could say that it was overall okay based on my students' feedback. And as usual, the reading part was a bit tough, they said to me, and the writing was quite okay, because after I heard the feedback from them, that I could say that writing was quite okay. And also speaking this most of the topics which we have discussed already also. And also these topics are familiar topics to the most of the students, and they have come across in their previous exams. And listening was quite okay, but reading was the only thing was a bit tough to them. So anyhow, hope for the best result. And whomever wants to participate or whomever wants to join in our class, our number has given in our description. So you can contact us at any time. You can join in our class. We are running the mock batch, and we have 10 days, 20 days, 15 days, and 30 days, 60 days, 40 days classes also going on. We have only online coachings, and also whoever wants to join for only your writing and speaking sessions, that's also available as per the package. So you can contact us at any time, and you can join for our class. Okay, so until then, bye bye.